Hi, Dr. Desmond White, gastroenterologist. I feel like doing a topic on hepatitis A today because I just had a patient with hepatitis A. He asked me so many questions, I jokingly say that he'll be an expert in hepatitis A. So let me educate people. First, what is hepatitis A? Hep A is a special virus that can infect the liver. We have viral hepatitis A, B, C, D, E, and there are other more such as CMV, EBV, TT, and maybe others. So hepatitis A, one of these viral hepatitis that can affect the liver. How do we get it? In developing countries, like not so rich countries where hygiene is poor, people are overcrowded, most of the time they are transmitted by fecal-oral transmission. Fecal-oral means from the feces to the mouth. So for example, my patient in the ward right now, he had acute hepatitis A. We may be able to detect the virus in the stools. And if the stools go to the mouth of another person, then the person can be infected. How can the feces from one person go to another person? So we call it fecal-oral. Well, number one, if we live in crowded places and hygiene is poor, after passing motion, the patient doesn't wash her hand properly, the hand may carry the virus, and if whatever he touch, he cough or whatever, he may actually transmit it to the next person. That's fecal-oral. Poor hygiene, overcrowding. Or if this person work in the food industry, or is a farmer, he harvests the fruits like strawberry, oranges, other fruits, grapes that you don't wash properly, then you may also transmit the virus from the sufferer to the next person through the contaminated food that are not properly washed. Hep A are passed in the feces, and the feces go to the sewage plant, they're being treated. But in some developing countries, the sewage may not be properly treated. Imagine the viruses flow into the river, into the sea, and bottom feeders like clams, oyster, they are what we call filter crustaceans. They may filter the water and they may trap the virus. So for eating uncooked shellfish or seafood, not properly cooked seafood and shellfish, you may get it as well. Again, it is still fecal-oral. Very rarely, Hep A can be a sexually transmitted disease. Very rare. I haven't seen in my 30 years of practice, so it must be rare. If a male having either oral anal sex or penile anal sex, they can transmit the virus, because imagine the virus in the sufferer, they're in the feces, in the anus, so either you lick it or you put a penis inside, so either you have a anal sex or oral sex, then the sufferer can pass to the person. But this is very rare, okay? So after transmission, how the patient feel? Patient don't come into the hospital to telling me that, Dr. White, I have hepatitis A. Patient come in, usually they feel tired, they feel bloated, they have a fever, they feel unwell, they have nauseated, they don't have appetite, they feel bloating, they vomit. The thing is that when the liver is inflamed by any causes like hepatitis A or other viruses like B or C, when the liver is inflamed, it affects the digestive tract. It doesn't move very smoothly. So they feel bloated, they have loss of appetite, they feel nauseated, they may vomit after eating, they have constipation, the intestine doesn't move smoothly, and they feel bloated. So these are the symptoms. So today I've talked about hepatitis A, how we transmit the disease, mainly fecal-oral, rarely sexual. How we present, we don't present with hepatitis A per se, we present with hepatitis liver inflammation, and then from then we can detect. Okay, I forgot to mention one thing. There have been increasing incidents of hepatitis A transmitted among intravenous drug abusers, injection drug users. It is postulated that when a person had hepatitis A, the virus may stay in the blood for up to 1 month prior to the onset of the symptom. It can even persist for a while after he presents to the hospital. So imagine my patient in the ward right now, he had acute hepatitis A. If we and him are both drug addicts, I guarantee you I'm not, okay? But if I and him are both drug addicts, we share the same needle of, say, drug like heroin, whatever. We take from him, inject some heroin to him, and then I inject myself, then I can transmit from him to me. So we also see a lot of hepatitis A transmission among injection drug users. Last but not least, one particular group of people also got a lot of hepatitis A, and they are in the prison. We don't know what they do in prison. I've never been one, but it was postulated that people that go to prison may be from a lower quadrant of the society. They may have poorer hygiene, and they may carry the virus without knowing it, and they may they may through unhygiene practices, overcrowding, pass it in the prison. There could be, say, injection drug use in the prison that they share needle. There may also be illegal anal intercourse, oral anal sex in the prison. So there are many reports that suggest that there are outbreak of hepatitis A in the prison. So to sum up, Hep A fecal oral transmission, very rarely from blood transfusion. They present with acute hepatitis, and that's all for today. Dr. Desmond White.